Good morning. I could not help but stop to do a little video about the topic of arrhythmia and the ketogenic diet. So you might be asking me, well, Melanie, you're not a cardiologist. No, I'm not a cardiologist. What is your medical degree? Absolutely nothing. And then you might ask, well, then what makes you an authority on arrhythmia, atrial fib, and the ketogenic diet? And my response to you is going to be that I am living a ketogenic lifestyle with a pacemaker. Why do I have a pacemaker, you might ask? And that's a brilliant question. I have a pacemaker because I suffer from heart arrhythmia. I suffer from a sinus node in my heart that does not communicate with my head, so it does just pretty much whatever rhythm it thinks it's supposed to do, because the brain controls the heart. Well, when the brain is not sending signal or the heart is not receiving signal, it like survival mode. It's like, I don't know what I'm supposed to do here, so I'm going to beat really fast. Or I don't know what I'm supposed to do here, so I'm going to slow down. Or I don't know what I'm supposed to do here, so let's just beat every other beat, because the heart doesn't know unless the brain tells it what to do. So why am I on here? If I'm not a doctor and I'm not a cardiologist, then why am I on here talking about a pacemaker? I'm sharing my experience. I'm sharing what I know about my pacemaker, what I know about my heart condition, and what I know factually has happened to me since I started keto. So, disclaimer. If you have any medical issues whatsoever, please consult your physician, because keto is not good for everybody. I am not one of these people that's going to stand up there and say everybody in the entire world needs to be on keto, because they really don't. If what you're doing is working for you, you go right on ahead and keep doing it. But who I'm talking to right now are the people that have tried everything and nothing's working. Who I'm talking to now are other heart patients, other pacemaker patients who have a serious obesity problem, or maybe type 2 diabetes or PCOS, and your doctor is scaring you to death about the ketogenic diet and pacemakers. I am not giving you medical advice. I'm only talking to you as a fellow pacemaker patient and telling you what keto has done for me. But do not follow my advice unless you speak to your doctor first. But you can share my video with them. You can talk to them about what I'm talking to you about. You can say, hey, there's this lady on YouTube who's 49 years old. She has a pacemaker due to sick sinus syndrome. She suffered from massive bradycardia syncope, supraventricular tachycardia, atrial fib, palpitations occurring in 25 runs or longer, skipped heartbeats, the whole 9 yards. And she started keto, and she has seen a dramatic change, not only in her weight, but reverse type 2 diabetes, and has seen a 30% decrease in my pacemaker activity. So, let me give you a little bit of backstory, and then let me tell you about how I know what's happening with my heart. So, 15, 17-ish years ago, I had my first episode of atrial fib that I'm aware of. And I'm aware of it because I passed out right in the middle of somebody's front yard. The ambulance came. I was in atrial fib, but I was also suffering from bradycardia syncope. They rushed me to the hospital. I was in the hospital for, I think, about 3 or 4 days. They had trouble getting my heart back into a normal sinus rhythm. They put me on a metoprolol. They put me on a couple other medicines and, of course, on nitroglycerin. They said that I was at a high risk because of the type of rhythm that my heart was in. I was at an extremely high risk for a stroke. So they put me on these medications. They kept me in for observation. I had my first stress test, but because I was in atrial fib and because I had passed out, they did a nuclear stress test, a chemical-induced nuclear stress test. And, but because that was my very first incident and I was in very good health and I was very young, they didn't really pursue it much further other than to say, hey, this is what we saw. It was your first time. If you have any other symptoms, call us. We'll run some more tests. But other than that, once my heart went back to a regular sinus node, I didn't have any more problems. Till about 3 or 4 months later, I started noticing now, because that was such a scary event. You know, the mind is a horrible thing. When you're really afraid of stuff, your head can actually cause things to happen to you physically and emotionally and medically that maybe wouldn't have been so intense if you weren't so stressed or you weren't so scared. You know, like adrenaline, or cortisol, or fatigue. You know, all the things that can happen when you become stressed or tired. So that was a pretty scary incident for me, especially since I was in my 30s. Then I started noticing heart palpitations, the fluttering in the heart. Felt like there were little bubbles going off in my heart all the time. I noticed feeling the sensation from time to time. And when I say time to time, I was having these episodes maybe once every 3 or 4 months. And I always knew it was coming on because I felt a tightness in my neck. Like it felt like someone injected hot water into my carotid arteries. I would feel a shortness of breath. I would feel like my heart was racing. And then I started getting some pain behind my sternum that felt like it was coming from the heart and then radiating across my chest. They call that angina. All right, so that was the beginning of my heart issues. Let's fast forward 5 years. So from the first episode, about 3 to 5 years after the first episode, I had another episode. But now these episodes were happening every 2 months, every 8 weeks to 2 months. So I would have these episodes where my heart would just totally go off the rails. It would be really bad for about 3 to 5 days, but by the time I'd get into a doctor, my heart would be right back to sinus nodes. So they put me on a 30-day monitor. After having the monitor for 30 days, they recorded over 200 episodes where my heart went into some kind of crazy rhythm. It was never the same thing. Sometimes it was atrial fib, sometimes it was bradycardia, sometimes it was supraventricular tachycardia, sometimes it was just throwing PVCs, right? PVCs are absolutely normal, and it is very common for a woman in her 30s to feel palpitations when she is experiencing perimenopause or menopausal symptoms. Hormones have a direct correlation on your rhythm, but so does diabetes. I'll get to that in a minute. So I started having more and more frequent episodes. They said those, so they started experimenting with rhythm drugs that would regulate, because they couldn't find a blockage. My valves were working properly. I had had echocardiograms. I had had the tilt table test, which let me tell you is the most frightening freaking test I've ever taken. I'm sorry if you have to have a tilt table test, but that is horrible. That is the scariest freaking test I've ever taken. Let me just leave that there. So they were running me through all these tests. They were trying all these experimental drugs. Let's fast forward now to a year before I had pacemaker surgery. Well, first of all, understand that I had this doctor that was an absolute freaking quack. And I could have sued him for gross negligence and medical malpractice, except for the fact that because he didn't cause me permanent damage, I couldn't find a lawyer that would take the case because they said that medical malpractice suits cost a lot of money, and because all he cost me was a year of pain and suffering, they wouldn't be able to recover the amount of money it would cost them to try the case. So I found no one to help me. Anyway, that's another story. So they put in a loop recorder. This loop recorder, the battery, for any of you who know what a loop recorder is like a heart monitor, but they implant it above the heart, and it has certain parameters in it. So if you go into atrial fib, it records it. If there are certain heart rhythms that if you go into, it records it. I was averaging between 100 and 176 recordings a week of my heart just like going nuts. Meanwhile, my symptoms were, my fingertips were numb, my mouth would go numb. It was like a neuropathy kind of thing going on. I felt a tingly, cold, prickly sensation on the tops of my thighs. I constantly felt like I was doing this, breathing, and I could not get enough oxygen. My oxygen concentration was about 96, 95, which isn't too horrible. I was suffering from blood pressures at about 80/50. My rested heart rate was 43, but my heart rate while I was sleeping was going down into the 30s and even hit 20s a couple times. I would wake up in the middle of the night gasping for air because my heart would stop. My heart would stop. It became so incredibly frightening. Anyway, so I wanted to lay out that little history there. Finally, my primary care physician had had enough. I'm like, I can't live like this. I'm about to lose my job. I'm about to lose everything. I keep having to go out of work on medical leave, FMLA. Thank God I had that. You know, I kept having to go out of work. I kept missing time. I was afraid of losing my job, which was causing the stress to be even worse, which was causing my heart to act even worse. So finally, my doctor gave me a referral to another specialist. So thank God. Thank God. So I went to this specialist. He looked at my history. He ran a couple tests, and he's like, every medicine, understand that there's about 5 or 6 main medicines that they put people on to help control heart rhythm, right? But if the sinus node is messed up, it's not getting a signal, and that medication's not going to do much for you at all. So finally, a diagnosis of sick sinus syndrome, which is what my father has, and my father has a pacemaker for the very same thing I have. So they put in the pacemaker, and that cured a lot of my symptoms, right away, because now I'm getting appropriate oxygen. Let me tell you, lack of oxygen will do a lot of messed up things to your body and your brain. So now I'm getting more sleep. I'm not as worried. The pacemaker's working. It's doing what it's supposed to do. My heart's not stressed. I'm not having angina. All of the things that came along. So my quality of life improved greatly. But still, every 6 months, I go to the doctors and they download my pacemaker information. They can see how many heart episodes, how many palpitations, how many atrial fib, they can see every single missed heartbeat, fast heartbeat, slow heartbeat. Even if it only happens for 1 beat, they can see it. And it records this information. And then my cardiologist gets this printout every 6 months that tells me at what percentage my heart is going into some kind of arrhythmia. Before I started keto, my very last appointment, before I was keto, my heart on average was pacing my heart anywhere between 42% and 56%. There have been times before keto that I went to the cardiologist and he confirmed that I only had like 8 years left on my battery. Well, let me tell you, my first 6 months on keto, my first cardiologist appointment, I was floored when I sat there and he said the last 6 months, not only had I lost 11 pounds since I had seen him last, and 24, 25 inches, I had reversed my type 2 diabetes, but my heart was pacing at 13%. 13% from 42 to 46%. Now, I'm not a doctor, but my only logical conclusion to this is they're finding out that diabetes also has a huge role in heart arrhythmia. They're finding out that it's like they're calling dementia type 3 diabetes. They're finding out that diabetes is attacking people's systems on multiple levels. So, let's say that I have the same disease my dad, the 6 sinus syndrome, which would explain the 13% of the time that my pacemaker has to keep my heart beating. It reduced my arrhythmia episodes by 30%. So when these doctors with their big medical degrees and making money off the pharmaceutical companies, may I add, come to me and say keto is bad for your heart, my question is how? How? And you know what I'm going to do? The next time I have a cardiologist appointment, I'm going to get a printout of my pre-keto heart rhythm and my post-keto heart rhythm. And I'm going to ask my doctor if he could please show me where the numbers are to show how many times my heart needed a pacemaker or I would die. Basically, when you say 13%, you don't need a pacemaker. Okay, understand that if I did not have that pacemaker during those 13% of the time, I was at risk of stroke, I was at risk of heart attack, and I was at risk of my heart stalling completely. Because when I'm sleeping, my heart rate will drop down in the 20s. And that's a lot like driving a car in second gear under 10 miles an hour. Your heart's gonna stall, the car's gonna stall. So, I still need the pacemaker. But keto. So my last battery check, 9 years. It went from 5 years to 8 years to 12 years to now 9 years. So, there's that. Once again, disclaimer, I'm not a medical doctor. I'm not advising you on what to do. But please do your research. Please do your research. They don't have long-term studies of pacemaker patients, patients with chronic arrhythmia, women with severe menopausal symptoms, women with low estrogen symptoms. They just don't have enough controlled studies to prove anything. They're grasping at straws. Keto, the keto lifestyle, the keto diet is putting doctors, pharmaceutical companies out of business. They're putting Weight Watchers out of business. Ask yourself. Ask your doctor first. But just understand, medical doctors are not trained in nutrition science. And there's the American Medical Association that mandates what a doctor can tell you as far as what to do as a nutrition plan. I'm just saying, I've suffered from a heart arrhythmia for such a long time, and it just so happens to be that I start keto and my heart arrhythmia is dramatically decreased. Coinkadink? I think not. Anyway, once again, see your doctor first. That's my disclaimer. Keep being a ninja. I'll keep being a ninja. Let me know below. What are your symptoms? Like, what are you going through? Do you have a pacemaker already? Are they talking pacemaker? I'd be happy to talk to you. You have a great day.